I am Malikah Marrus. I am a clinical assistant professor in the social work program. The social work program is 3 years old here at UCCS, and in March we got our accreditation, which took 3 years to get. It's a 3-year long process with these wonderful people and some others that are not with us today in this room, but it's a very long process, and we have educational standards that we have to follow. And I will talk about how ethics plays a role in that. And we offer both an MSW and a BSW, so we hit undergraduate and graduate students the same. And so social work education, you have to, in order for your students to be able to sit for licensure in any state, you have to have an accredited program, which we now are, and it goes back to our first graduates that were last year, so that's great for them. There are 9 competencies that we follow. I'm going to do the new 9 competencies because I think I know those a little better right now. So there's ethics and professionalism is competency number 1 that our students have to learn about. Human rights, social justice, economic justice, and environmental justice. Anti-racism is a competency that our students have to have an anti-racist social work practice. Policy, informed practice, practice informed policy. So our students have to be exposed to policy and understand how policy works, affects them. And then research is also a competency. Our students need to know how to use research, how to conduct research. And then there is engage, assess, intervene, evaluate with individuals, groups, and community. So all those competencies have to be addressed. Here at UCCS, although we address all the competencies, ethics has been a very important part since our beginning of our program. I actually, the day of my interview, our program found out that we were getting additional ethics funds from Daniel's Fund Ethics Initiative to roll out some things for our program. So it's been a journey, I think, that has been wonderful so far. And so far, every year we've had an ethics fellow. Hopefully that streak will end this coming up year. All of our students have to do a practicum placement, and you will hear that I use the word field and practicum interchangeably. We are getting rid of the word field here on campus and using practicum, but I use it interchangeably because we have not done the full exit of the word field. Our BSW students do this in their senior year. It is 400 hours in the fall and the spring. They're at the same agency for both semesters. So it's 200 hours a semester. And Isla, who's in here, places those students with agencies in our community. And we consider our community Southern Colorado. We do have some people that are further out, and we do have some international students because of their military affiliations. And then our MSW program, our first year students, like the BSW students, do 400 hours of field practicum. And it's at the same agency over fall and spring. And then our second year students, our specialized students, do 500 hours over fall and spring at an agency that they likely did not do their first year unless it was their employment, and that's a whole another ball of wax. But we are responsible making sure our field instructors are working with our students, and those are people in the agency that coordinate their class, their work that they do, and also other aspects of meeting the 9 competencies. So ethics is very important in social work. National Association of Social Work has the Code of Ethics, which is our governing code of ethics. that we abide by as social workers, and our students learn to abide by those code of ethics also. And this is where this is where my program is from, and I'll explain a little more, but I want you to know that we do have the code of ethics. There's also an international code of ethics that mirrors almost exactly the NASW code of ethics, but that is for social workers that are outside the United States. You do, for your requirements for your licensure, you do need to understand the code of ethics and take an exam in most states that are related to ethics. And we expect our students to do well because they've been fully prepared. I will say that it's not only in our field courses that we teach ethics, it's intertwined in every course that we have. So every person in this room has touched on, who teaches social work courses, has touched on the code of ethics and ethical decision-making by our students. It is really how we ground our students and our profession. So we're all familiar with the Daniels Fund ethics initiative principles, but I wanted to point out that how closely we can pull those principles out from our own code of ethics. So integrity, we expect all social workers to act with honesty in all situations and be truthful to their clients, truthful to the profession, and practice with integrity. That we build trust with not only our clients, but our communities that we are serving in. And so I think it's important for us to all remember accountability, transparency, and that the fairness really touches to our goal of practicing human rights and ensuring social, economic, and environmental justice, and the rule of law, that we comply with the spirit and intent of laws and regulations. So we have used our money at different ways, but developing ethical social workers in this area and to strengthen the social work professionals that we work with. We conduct yearly programs that happen in the beginning of the year and in the springtime. And then last year, because Stephanie Gangemi was a superstar, we did an all-day ethics training with actors and crisis intervention coaches for all of our students that were placed in field at the time. And it required every single person in our department to be hands on deck to help with that event. And Stephanie nicely tied Island in so we could talk about different case examples that we would see in the field. And so our students did that for a whole day. Please go back to the YouTube and watch Stephanie's video about her ethics presentation. So our students are exposed to ethics in their new student orientation right away. So they do a half-day orientation, which 2 hours of it is ethics. All new students have to attend that event. They cannot miss it because we've had to be flexible. We've done a high flight situation where students who may not be in the country or ill or have childcare issues, a host of things, we do allow them to watch it online, but we have an ethics presentation that would be done by either Isla or I as orientation. And then that is at the beginning of before school starts, and then the second week or so of the semester, third week, we have a second orientation, which also covers ethics topics with our students. So we get them in the beginning, make sure they're clearly understanding the ethics of social work and how this applies to what they're doing. And then in our practicum seminar courses, we have modules on ethics. They also write an ethics paper, presentations, some group work around ethics. And then in their placements, they are supposed to be talking about ethics with their field instructors, and you'll understand why this is hand in hand, because we need more of that. And then other courses bring up ethics. Our field instructors also get an orientation at the beginning of the academic year that covers ethics for them also. So we are reminding them about ethics, which helps them with their continuing education because they need the ethical hours for that. At UC Health, we have a partnership right now with UC Health where the social worker and the behavioral health staff get 2 seminars a year, 2 educational things, and one of them is always related to ethics. And then we've had every year since we started, right? We've had an ethics workshop in the spring for our field instructors that have been online, so they could attend that. So hand in hand. So as I was thinking last year about how we can strengthen our ethics training, I realized our students are having separate conversations about ethics, and our field instructors are having separate conversations about ethics, but they are not having those conversations together. They're not sitting down and having these conversations and discussing what is ethical, what's unethical, and our students tend to be a little more on like following the exact wording of the code of ethics. So they may be like, nope, that's unethical, you can't do that, but not having the conversation about what that looks like and why do they perceive it to be unethical, and why would their field instructor not seem to think that's unethical. And so having those conversations to me is really important. So starting with 2 ideas, so our BSW and our first year MSW students can have the same training. And then our second year MSW students would have training on a separate topic. In part, I wanted to make sure that the BSW students and the first year MSW students had the same, is because in many ways our BSW students and our first year MSW students are almost on equal ground in level, except that our BSW students have some coursework under their belt, and our first year MSW students are jumping into the field and doing their coursework at the same time. And our BSW students have had a few classes already that have prepared them to go into the field. And in addition, social work has this nice thing that most programs would like call it an accelerated master's degree, but our BSW students across the country in social work, if you graduate with a certain GPA, you can apply for advanced standing, which takes your MSW program down to 1 year instead of 2 years. And so this year, for example, out of our 23 or so advanced standing students, 4 of them are not our own students. So we have, this graduating class has put them into our MSW program. And we're starting something new with those advanced standing students where they'll have an orientation in the summer, and they will also do ethics training in the summer before they actually start their classes. So first, setting the stage, our students, there's an ethics quiz that was developed, and I don't want to mispronounce her name, by Alison McDonald from Alberta College in Canada. And she's developed an ethics quiz, one for students to take and one for field instructors to take. They are almost similar, but the field instructor has to give a little more detailed information. And the students and the field instructor will sit down and after they both take the quiz and have a discussion about their answers and see where they're both coming in at that moment. So that's the first step, is to talk about how you view things on the quiz, and the field instructor has to give a little more detailed information about why they came to that rationale. And so I think it's important, and it covers all areas of the codes of ethics. So not just duty to warn, which we've focused on in the past in the social work department, self-determination, which we'll talk about, leadership, cultural humility, practicing with cultural humility, staying in your lane, dual relationships, everything that falls under the code of ethics, this little quiz covers. And so that's the start of their conversation about that. They spend about 12 hours a week near their field instructor, and they have an hour supervision every week with their field instructor. So there's plenty of time for them to talk. It's not like I'm asking the field instructor to add even more hours to their day, because they are doing this for free for us. Like, we don't pay them. They're doing it for the profession, they're doing it for us and our students. And so for some of them, it's a lot. Like, we have some agencies that will take about 4 or 5 students. And then we have some agencies that like, let's start really small. And we're like, sure, we can do that. And part of this is because they do spend so much time with them and working with them. And then they have to send in the results to me. So the first module is on self-determination. It's a core ethical issue for social work. It's difficult for new social workers to understand, and more experienced social workers. Learning to apply when there seems to be no room for self-determination. And my students have reminded me enough that they don't get to discuss self-determination, what that really means, enough with their field instructors. And so we see some of the questions arise with children. Do they have a right to determine where they live? Do they have a right to determine if they take medication? Do they have the right to determine if they have a label placed on them? Do children have a right to determine if they get medical treatment or not? Do children have a right to determine the pronouns that they use? And do children have a right to determine their name and the name they'd like to go by? The name that was given to them maybe by their birth parents? Do they have a right to know if they've been removed from the home? Do they have that right to determine if they would like to keep up relationships with their birth family as opposed to the family? So these are all questions that arise. With court mandates, do people who are ordered to go to drug treatment, to therapy, any host of services, do they have a right to say no? Is that included in self-determination or not? And in medical settings, adults and children alike, do we have a right to say what we want medically? I would say that these questions, like, our students are like, I don't know. And field instructors will be like either no or yes, or there's this gray area. So we start with our students though by telling them they have a right and a choice to do their assignments in class. There are consequences if you don't do those assignments, but you have a choice, right? You can turn in that paper or not turn in that paper. The choice is yours. But as the faculty member, we have a right not to give you any points, and you could fail the class for not turning in those assignments. Then they're like, oh, this is really interesting, this whole self-determination stuff. I'm like, let's start it there. And I think we've had students who choose not to show up to class, right? I think we've all experienced this. That's their choice. There are consequences to that choice of showing up to class or not. And so that's the first level of self-determination that we have this conversation about, is their own self-determination in doing this. I will say that we have had this conversation just yesterday on a medical issue, and an intern who's now also employed by UC Health was like, this client was not given her self-determination. And she called the nurse, the charge nurse on that issue first. Instead of going to another behavioral health, she was like, no, I think there's a problem here. This patient has the right to take this medication or not. The patient did not like how the medication made her feel, and she did not want to take it. And the charge nurse was like, no, your behavior is erratic and you're going to harm somebody if you don't take it. And she's like, I promise you, I'm not going to harm anybody, not even myself, but I'm not taking the medication. The nurse decided that she had to be restrained in order to take the medication. The patient got on her bed, assumed the position. She did not fight the restraints at all, but she really did not want to take the medication. And the security guards walked out of the room. They said they were not willing to restrain the patient because they felt like the patient had the decision to take the medication or not. And the social worker was impressed that the security guards felt the same way as her, but not the nurse. And the nurse attempted to write her up for that decision, that she felt like the client had the right to the decision. And her supervisor backed her up, but she was like, I don't know, like, did I do the right thing? And she asked her classmates, and we had this long conversation and discussion about the patient's right to decide to take that medicine or not. And I was impressed with the students thinking, but she still didn't really have a conversation with her field instructor about it, right? Like, it was the field instructor's like, you were right, like, you should have been written up, we're gonna remove that from your file, which was great because she had this interview coming up for a new position there that she really wanted. So she was worried about that. But the conversation still didn't happen about where's that gray area and where does that fall in. And it's interesting because as faculty, we've all worked in different areas in social work. And so Stephanie has worked in prisons, in mental health arena, which their self-determination looks a little different than somebody else. Yes.
Well, I would say that's a real tough spot.
Mhm.
So my mind goes to, well, what's the age of the client? What is the law? What is the legal responsibility to healthcare? What's the legal responsibility of the security guard? Because as soon as I think the strong arm's gonna come, right? You know what I mean? The voice gonna come in. How does that play out?
So do you talk to your students about the importance of talking about the consequences with the client, number one? And then do you talk also to your students about figuring out their consequences?
Right, and so that's an important conversation to have, right? Is the consequences not only talk to your, like we talk to our students about the consequences of not turning in assignments, they need to talk to their clients about the consequences of their decision-making process also. But the aspect of the consequences for the student in that placement, that needs to be a field instructor conversation that is not necessarily happening.
So if this was an ethics on nursing, I wonder what would be the nurse's case of view, right? Say, hey, I was in this situation where a client refused this medicine. I don't know what their obligation is, saying, what do I do as a professional and a representative for CU Health and everything else?
Right.
That's a tough spot.
A very tough
'Cause that's
spot.
not, is that well defined or not? I don't know much about it. Are there laws around this, or is it just?
So it goes to another part of the work that I know that you do, which is the collaboration between professionals, right? So when you're talking about ethics, you're viewing it from your little avenue, but if you're working in collaboration, you have to expand that. And that, I know, like, that's like some of the work that we do with the law and social workers. But that's true for health professionals and social workers and how they're going to view those together and have those discussions together. So goes even past, I guess, the field instructors,
Right.
but to the whole agency.
What kept coming back to me was the responsibility of providing the right information for that self-determination to occur at the best possible level, right?
Right,
So in the nurse's situation, had that all been explained about, why the location is it, or where is it, so that person can make the right decision. But also on the nurse's side of self-determination, if I'm not feeling safe, what,
right, and if you're not, is it that you're worried that if she doesn't take the medication, what does that mean? And then the fact that the security guards weren't willing to restrain her, what else is going on here? Is there something else that we're all not seeing happening below the surface that may not be? And it may be the relationship between the patient and the nurse, and that patient may have a different relationship with the social worker and the security guards. Like, she's been there a long enough time that the security guards may have developed a good relationship with her, that they feel like they could verbally talk to her and get her either to do something, or that they know that she won't attack them just because of the relationship that they have developed. It multiple layers.
Well, even when you look at medication, I mean, sometimes your medical professionals say, you take his medication, I don't really want to take that.
Right,
And it's, I mean, I'm on the finance side, the drug companies are interested in one thing, and that is selling doses, right? Pushing doses. And how do you know that medical professional isn't hearing something, this is what we always do, not knowing,
right.
what's the determination of this patient?
I was supposed to say, you really need to take this, the season nurse, like, so.
Yeah,
Right.
experience.
And
But there's no code of law around this, right?
Right, no,
Like in
and-
finance, is a pretty established code of law. Here I'm saying, well, where's the code of law that provides rights and responsibilities?
right, and because the hospital is interprofessional, it has many professions working together in different realms, right? Like, everybody has their own piece of the pie.
And just kind of to add to what you're saying about that legal piece, then you bring in court mandates and who
Yes.
is legally mandated to receive what services, and does it include pharmacological interventions? And then how do you enforce that when we say self-determination versus, so the pocket's very muddy.
Muddy. How does this all play out? And how does your field instructor, who's a professional, at least 2 years in the practice, right? Because in order for us to have you as a field instructor, you have to be 2 years post your MSW. Like, where, from your experience and your time, where does this, and would it be different if you were in a different setting?
And people just have different viewpoints, no matter what, right?
Right.
So those discussions become even more important. And I know from the legal side, I always tell law students, you have to have those talks before you start interacting with those other professionals, so that you're on the same page. Because lots of times what we mean by self-determination is different than what you mean, or vice versa.
Right. So, and I will say that one of the nice things here at UCCS, we've started doing simulation with the nursing students on intimate partner violence. And that's been interesting, like listening to the conversations and our students having their code of ethics in their mind. But there was one answer that both the nursing students and the social work students thought it was a horrible answer, that the simulation told them to pick, right, was the right answer. It was to go home, right?
Yeah,
After
it was after some divulging of potential harm,
harm,
and it was rather than to delve into it, it was gone.
go home. Like, you have a client coming up and you're gonna be late, so go. And the social work students and the nursing students were like, well, that's the wrong answer. And we're like, yes, it is. Like, and one nursing student was like, that's it, I'm tired of this. And I was like, okay, but let's talk about why we were circling around and why that is the wrong answer. At my previous institution, we sent nursing students and social students out on home visits. For homebound older adults. And they were going to use an iPad with them to do a fall prevention class, but they were also doing some assessments like for Meals on Wheels, and some care to come into the house. And this one older adult male, wasn't sure why they were coming into his house in the first place, like who called? Why did you call? And he said some remarks that the nursing student and the social work student were taken aback by. But when they came back to report to the Center for Aging and to the faculty, the nursing faculty and social work faculty, the nursing student was like, we can't help him. Like, he's racist, we can't help him. And the social work student was like, I don't know if he's racist, but his terms are a little outdated, but they may be from when he grew up. Like, and he needs help. Like, the house is a mess. So if he's gonna let us come in and help him not fall, I think we should do this. And the nursing student was like, no, no, no. And she was like, no, the social work student was like, no, I think we have a responsibility to offer him the service and encourage him to take the service because he needs help. And so it was interesting that conversation that we had to have with the students on that. So it is a very sticky situation, and I think it's a time that social worker students need to understand self-determination a little better, and starting at that level of what their level of self-determination is brings it home to them. But then talking about and giving scenarios in different places. So giving people who work in the courts or probation or with the public defender's office, giving situations in the medical setting and behavioral health setting so they understand a little better. And then for those who work in the child welfare system or work with children in schools also. Because again, even in high school, you have the choice to do your work. You may not pass.
Well, and I think too, when we talk about self-determination within social work, and I think you all have said it, that defining of what is self-determination. If you're familiar with the code of ethics, it goes into specific standards. And so then there's the standards of what our obligation is to our clients, but then also what's our obligation to the profession. And within there, it kind of talks about that self-determination and when a person really doesn't have a right to self-determination because they're incapacitated in some way to make that decision for themselves, that it's then our obligation to protect them in such a way that decisions are made that's going to be in their best benefit. So it's not as black and white as it looks, because you have to kind of delve more into those codes to guide us into where do we go. And then knowing those codes, and that's where that collaborative comes in when we're working with the disciplines, knowing what are their standards and how does it fall and how does it all work. And so this having our field instructors have the conversation and not just go, oh, well, no, you were right, or no, they were wrong, or yeah, don't worry about it, right? It has to be more than that because it really is what guides our practice overall.
And so to move it away from healthcare, I worked with a legal aid clinic at a law school. And they were representing children in child welfare cases. We had a case where there was a child who was she was in elementary school, so probably 8 or 9. She was more mature than her mother. And when the adults in her life were fighting over where she should go, she sat down and we had a conversation, and she was like, look, I should be with my mom on the weekends for the fun stuff. She cannot help me with my homework. And she won't be able to help me as I get higher up in school. So what are we gonna do? And she thought the friend of the family would be the perfect placement for her, except she did not know that the friend of the family was going to move out of state, and they had planned on taking her out of state with them. She didn't know that, and she was then introduced to her aunt and uncle who lived about 4 hours from where she lives with her mother. And so she was contemplating where she should go. But nobody but her attorney and her social worker were asking her like what she thought. And I think she had that right. She knew what was best for her. And she didn't know that other piece right there, like, and that was the hard part because I didn't feel like we were the ones necessarily should have that conversation. I think that the adults needed to let her know they were moving. The mom didn't know at that point either that the friends who were the foster parents were moving either. Like we knew, the attorney and I knew, but nobody else in the situation knew, not even the judge, not even the attorney for the county. Like no one knew that. We had that piece of information and we had to get it out some way, but as the attorney was sitting with the adults who were fighting over this one child, like I'm having a conversation with her and then the attorney and I switched and I talked to the adults and she talked to the child. And again, the child has really thought this thing out clearly. It's not the only child that I've ever seen think things out clearly and the adults not think it out for them. A child that was accused of sexual assault on another child had a younger brother living in the home. And so the mom was like, well, the child that's being accused of sexual assault, since I have the younger child in the home, they can go to their grandmother. And the judge asked the grandmother, where do you work? And she's like, I run a childcare center. And when he gets out of class, out of school, he can come to the childcare center and wait for me to go home. And the kid is like shaking his head, like, nope, that's not gonna work. And the judge is looking and I'm like, oh. And I knew she was gonna send the kid home. I mean, he was young and he was little, like he couldn't even see over the bench, like he was very little. She wasn't gonna place him in detention. I knew that. And I saw the team come in that was gonna take care of him and make sure like his home life was situated and the check-in process. Like I knew all that was gonna happen. And the kid only wanted to go back to school. That's the only thing he wanted to do. He wanted to go back to school. He was doing well in school. There were some questions about really what happened, what transpired, but he wanted to go back to school, right? And so whatever that took for him to get back to school was what he wanted. But in the process, he also knew if he could be around other children unsupervised, like why would you send me to a place, a childcare center, right? Like didn't make sense. And so the mother and grandmother keep going on and the judge is sitting there and then he raises his hand like he's in school. And then the detention hearing judge was like, yes. He's like, I think my younger brother should go with my grandmother and then he could be at the childcare center during the day while she's there working. And I can be with my mother and then we're still separated, but at least I'm here and I can go to school and he's in a safe place and we're not together. And the judge is like, well, that's what I was gonna suggest. He's like, okay, but the judge allowed him to speak and to have a say. They agreed. I mean, it could have been that they didn't agree, but right, like she was on
He's able to
board.
advocate for himself.
Yes,
He's supposed
it
to
really-
listen to someone advocate.
Right,
Sometimes we shut people down. We don't want to
right, and
allow
his
them.
attorney was willing to listen to him
Yeah.
too, which is not always the case also, so, yeah. And we just had this discussion, and leadership, because I'm running out of time, so. It's social work, ethics, and DFEI is important. Leadership is important to both. Our goal is we're educating not only brilliant social workers, but leaders who are going to take on leadership positions when they graduate. We have one graduate that is going into their master's and the assistant deputy of our child welfare system here in El Paso County wants him to get the experience of working with families, but wants him on this leadership track. We have another student who wants to work in child welfare, but doesn't necessarily want to work with families fully, but wants to do some compliance work and be a leader in compliance work and making sure that caseworkers are doing what they're supposed to be doing. It's great. We're training leaders in addition. And so we also want our field instructors to think about their leadership roles that they have in the community and at their agencies. And I think sometimes they forget in the back of their head about their leadership roles and what ethical leadership looks like and what should they be doing as ethical leaders. And so, and looking at multi-level leadership, so that midnight or that CEO of a nonprofit or assistant deputy of our child welfare system. And so the focus for the students is to look at leadership at all levels. What makes a good leader? Why does ethics matter when you're leading people? And how to prepare for leadership? What does that look like? How can you have, as a leader, these ethical conversations and make sure that those people that may be working underneath you are practicing ethically in their work that they're doing? I'm not going to name the agency, but we had an agency where the students were concerned about false billing under Medicaid. And what does that look like? And what happens to their license if their name is attached to that? And they didn't have licenses yet. They were in school, they were working on that, but what would happen to their license if their name was involved in all this? And what kind of leadership allows this to happen? And I think that's a really important conversation to have, that not all leaders practice ethically, but how can you do that? And not point the finger at necessarily and say, you're unethical as a boss, like, but what does that look like and how do you have that conversation? And we were fortunate in that site that an employee who was not, they were our student, but they were employee at this agency and they were not doing their field placement there, ended up being the whistleblower. And then the person quit the job, which was fine, but it wasn't their field placement. She felt there was she had a little more room to do that than the people, the interns that were there, or the student that was interning there but was an employee and she needed that job. Like, she felt like she could quit, get a job unrelated to social work whatsoever to finish up school. She felt like she had the room to do that. And so she whistled, well, and so there was a full investigation. That agency is no longer open. But she thought it was in her code of ethics to do so. There are other ethical issues there too. The student was triggered last year at Stephanie's ethics event because I didn't realize everything that was going on there, but her boss was trying to get into her personal life, trying to get her to go out drinking with her, wanted to know about her boyfriend, all this stuff. And we put her in the scenario that was equivalent, and she's like, whoa. It was a great learning. It helped her learn how to separate some things and look at those boundaries. But yeah, like, there are concerns. And so those are the reasons I picked those two, is that our second year students will be graduating from the MSW program, becoming leaders in the community. And so I was concerned that they have those conversations about ethical leadership and ethical management, so to speak, with their field instructors. And again, I don't think it happens enough, right? I don't think we have those conversations. We can say what happens in a textbook. We can say what we think is going to happen, but we don't have those conversations enough with our students and our field instructors. I mean, we have to remind them sometimes of things that they're supposed to do. And we have this conversation, and I'm also looking at Monica in this because for a while Monica was helping in all this. Like, we have these conversations, we need you to do A, B, C, and D,
Get a B.
maybe D. You're not going all the way there. I was a student recently, like, it was like, I went to HR because HR told us to be open and honest. And then they got fired. I was like, what, so you were really open and honest? It's like, well, yeah. And I was like, that's good. What did you say? And he was like, well, I just talked about the CEO and the founder of the unethical things that she does. And he goes, and they fired me, but they waited a week before they fired me after the conversation in HR. And I was like, okay. And he said, but they said it was gonna be confidential, like nothing was gonna get out. And I was like, no. No. And, right, and we knew, like, he confirmed things that we thought in our head, but he confirmed those for us.
Yeah, so I'm Christina Jimenez, I'm a professor of history, and I'm a Daniel Ethics Fellow. I came in late, so I didn't introduce myself.
Yes.
But I mean, we've spoken before, like my family is all nurses, doctors, social workers. And something that I know just from years and years of being part of this family is that these discussions are so important, but there's not time for them. There's not time in your day, there's not time in your caseload, there's not time in your work life. And so how does that get
part of
addressed, you know?
part of their weekly hour of supervision,
Yeah.
which we check on. Like, I asked the students separately and the field instructor separately, how many hours have they actually met? So in that hour of supervision, have these conversations, do the module that is together. So there are modules just for the students that is on Canvas for them. And we will enroll all of our students that are in field in there. And then, thanks to Angie, I know where I can put the field instructor one so they have access, because I can't get in through Canvas. And we do have a field software, but it's not robust enough to do that. Yeah, in that hour supervision, and do that, and do it in the fall semester, the modules, but keep those conversations going in the spring. And I think as we keep our spring virtual it's been virtual. I don't know if we'll ever do it in person just because of logistics of getting everybody here. Like, if you could do that ethic event from your desk in your office, but have our students do it with their field instructors, not having them watch it separately in different places, but really having a conversation about what they learned in there. And so the beauty of all this also is that Isla and I work so closely together that we can ensure how our syllabus look in the fall, to encourage this, to give points to it, that the students, and this is just one more thing. We don't ask much of our field instructors outside of the supervision, right? We ask them to sign off on our students' learning contract, which this could be one of their objectives in their learning contract, is completing this together. And we ask them to do an evaluation at the end of the semester. We've also asked them to sign off on process recordings, but instead of doing the process recording in the fall for them, we can have them do the ethics and have that conversation that they need to have.
And your social work field instructors
Yeah.
have to have, I don't know what you call it, we call it CLEs, in ethics, right?
CUs, yes.
Okay, in ethics. So you can make it part of that too.
Right, that we can, problem will be they can't repeat the same modules for credit after the first time. So the first time they take the credit, Isla and I've had this conversation to expand through the whole code of ethics is the goal, like to go all the way through. It just will take us a little bit of time to get there. And the honesty is probably our field instructors would change enough over the years, except the ones that are just diehard, dedicated, may die at their job. There are some that will happen. We've been lucky, like with an old field instructor is now a full-time faculty member with us, so like, and doing other work, so there is turnover. Unfortunately, in some places, there's more turnover than we probably like, but there is that. So really getting them into the thought of using that hour time. And we tell our students also that they should take the lead in that hour of supervision, to come with an agenda, come with ideas that they want to discuss. And so they can also drive to make sure that that's taken care of. And if you give it to a part of their grade, they will. They'll make it happen.
And that's a good skill that everybody in any organization needs to have.
Right.
How to talk about ethics without making everybody think that you're weird.
Yeah.
Right, no, and I think it's just really, and it fits so nicely, because we have to have these conversations, but really driving the force and making people who are in the workforce keep having these conversations about ethics.
No, and I was just gonna add, with our field software program, we can develop forms to document so that we can track the information, and it gives us a way to collect the data. on what's happening in these conversations.
Yeah,
Or even providing guidelines for them in terms of, like, I mean, just think about the conversation that we had about that scenario. And maybe if, you know how students are, if they're like, I don't know what to say or talk about, you like, these are things, these are scenarios you
Yes.
should talk about.
Right.
Self-determination, you know.
right, and
Yeah.
we can pull them from our own practice experiences,
Right.
talk to our field instructors of experiences they've had.
I have a question. We actually put it in the College of Business for all internships, and we have 3 different internship programs here. That we put the Daniels Fund Ethics Initiative principles, and the student agrees to abide by them, and the employer for the internship agrees to abide by them. And we've actually had cases where the students are being asked to do something that's unethical or does not follow the principles, and they've actually been able to use that in order for some conversations with our career placement or intern director for that program. Is there
Right.
something like that?
Well, our field instructor application, when they fill out the application, part of it says that you're going to abide by the NASW code of ethics. So, and our students have that, although when they sign the form, we're gonna have them sign the form for our anti-racism statement. I think we can include making sure we have their signature, not just a verbal understanding between. Just really quickly, the thought is, for the fall semester, so orientation, then the first 3 weeks in, take the quizzes. October, everybody works their modules separately. November, they come together and do their modules together, and then December report back to us. So the timeline of the semester is a very nice fit, which can also go into their SMART goals for their learning contract. So there's dates that they can put in as we enforce that with them. So I appreciate everybody coming out today, and my colleagues are cheering me on today, so thank you. And if you've never been an ethics fellow, I urge you to. This is between the training in the beginning of the year, our all-day thing. I think that's some of the best training, and it really allows for interprofessional collaboration across campus, because we're all from different departments and we all learn different things, and I think that's been a fantastic part of it, so, thank you.